Well, October is Breast Cancer Awareness Month, and while we're here to support those currently in treatment, it's just as important to lift up our survivors to help them stay strong, stay active, and stay healthy.
Yeah, and that's exactly what our guest today here has been doing right here in Southwest Florida and along the Gulf Coast. Please welcome Dr. Bruce Nackfer, founder of Inspire Exercise Medicine. Good morning.
Good morning.
So much for being with us. I mean, This is a really important topic.
Thanks for having me.
You know that your background, you were a radiation oncologist, so you worked with cancer patients during the treatment, and now you're looking at trying to help them not come back to you and your colleagues.
Exactly. So I've been practicing radiation oncology here for 30 years, and I've seen over the 30 years how deconditioned a patient is after treatment, and so my initial interest was to see what can we do in order to help recover the patient.
Mm-hmm.
Yeah.
And that's from where we became interested in exercise. Initially the recovery, but then to our surprise, we saw there was a significant survival benefit to cancer patients, a reduction in recurrence for those patients who were exercised. And so for all of those reasons, we offer exercise, not just to recover them, but also to reduce the risk of recurrence.
How exactly does this work? How does it prevent cancer?
Yeah, that's a fantastic question. So when we exercise, molecules called cytokines are released by the tissues. They're released by the muscle, by the bone, by the soft tissue, by the fat cells, brain, liver. Almost every organ system releases these cytokines. We call them exerkines. Mm-hmm. And they collectively reduce inflammation, strengthen the immune system, increase insulin sensitivity, and importantly, allow our immune cells access to the microenvironment of the cancer cells, so that collectively reduces the risk of recurrence and improves survival.
I mean, people have been looking at, cancer for years, trying to figure out, how to prevent it from coming back. Is this kind of research new for us between exercise and cancer itself?
It seems new, but actually the data goes back 30 or 40 years, initially looking at exercise interventions to recover a patient.
Yeah.
But then they saw that they're actually doing better. Survival was improved. Recurrences were reduced. So over the last 10 years, we've been studying what exactly is happening. And we like to say that the exercise releases an internal pharmacy of medicines that collectively reduce recurrence and improve survival. In the last year, a lot of data has come out showing a 30 to 60% reduction in almost every cancer diagnosis with exercise. And then most importantly, in the New England Journal of Medicine, an article was published showing a near 10% survival benefit in a phase 3 randomized controlled trial where patients are arbitrarily assigned exercise or no exercise. And like I said, it was nearly a 10% survival benefit, which is an enormous number.
Sure.
So working out more than just endorphins you're releasing, making you happy. It's more than just making you positive. It's
exactly. It checks almost every box.
At Inspire, you've come up with specific exercises that seem to really make a difference for some of the cancer patients, not just breast cancer, but is it 10 different cancers, I believe I read?
We treat any cancer, cancer diagnosis of a patient that comes in. Obviously, the exercise program that we would have is different than a 70 or 80-year-old. The average age in Naples is 66 to 67, breast cancer, prostate cancer, a lot of elderly, but we also have very young patients. So when a patient comes in, they're screened, movement screen, strength, mobility, and then assigned into a semi-private class with patients at the same skill set, and then they have trainers, a couple trainers overseeing the program to make sure that they're not getting hurt, but they're at the same time getting to where they need to get for that stress in order to release those medicines that I spoke of.
Well, Dr. Nackfer, I believe we have, we're going to show us some of these exercises here this morning. Really important that we're able to know what we're doing, especially as we head into one of these classes here.
Yeah, great. So sure, here? Sorry, okay. So this is Emily. So the first exercise that Emily is going to conduct is a squat. So a squat is a very important exercise because almost every muscle in the body is stressed with a squat. A cue that we would use is breathe in before you go down and breathe out as you come almost all the way to the top so that you're bracing and protecting your spine as you go up and down.
Yeah.
Again, almost every muscle in the body is working, and the more hands on deck, the more that we incorporate, the more that we recruit, the bigger the biochemical effect for the patient. The next exercise Emily's going to perform is a deadlift, which is simply just a hip hinge.
And I mean,
again, working the
these are a lot of things that you do kind of every day,
Right.
too.
Well, it's
not
stuff
even
that
just
we
working
all
out.
used to do when we were young, and it was
Sure.
all ingrained to us. But as we
Yeah.
age and become less active, we lose it. So that's the reason why we like supervised exercise interventions as opposed to just giving a patient a list and saying, have at it. And the next exercise is going to be an overhead press. So the fundamental movements are a push, a pull, a hip hinge, a squat, and a weighted carry. Emily's going to overhead press. Some of our patients, we notice at the time of initial screening, have restrictions: shoulder replacement,
Sure.
knee replacement, hip replacement. And so we have workarounds for all of those limitations, because everyone has a limitation. Almost all of our patients have a limitation. All right, lastly, let's have just do a row. You can do
Yeah, we only have a few more seconds. So I
Yeah.
want to make sure we get to everything. So a row is another option.
It's a pull.
Very
So
simple
push, and then
exercises.
a pull, a hip hinge, and a squat. And lastly, it was just a weighted carry, which requires you to stabilize your body with your core. This is called a suitcase carry.
While we're
Or the
sitting-
groceries.
How can we get in touch with you at Inspire?
Yeah, thanks.
Inspire with
So
us.
we have our exercise center is in Naples at 3555 Craft Road. We also they can access us by our website,
Okay.
inspireexercisemedicine.com, or phone us at 239-429-0800. It's easier if the patients were to come in and see what is
Yes.
Sure.
actually
Yeah.
happening. The other benefit is that it's a community, and so cancer is a loss of control, and exercising, patients feel like at least they're regaining somewhat of a control over their life.
Sure. Thank you for what you're doing. We appreciate it.
Yes.
We'll put all this information, life-saving information, on our website as well as our Gulf Coast News app. 9:53. We'll be right back.